Have you ever wondered what happens inside your body when a hormonal imbalance goes unchecked? Today, we're taking a deep dive into the heart, exploring a rare but serious condition called carcinoid heart disease. It's a story that starts small, in the digestive tract, but has a profound impact on the very engine of our lives. Imagine your bloodstream as a busy highway. Normally, hormones like serotonin travel along it, acting as messengers. But what happens when there's a massive traffic jam of serotonin? This is what occurs in carcinoid syndrome, where neuroendocrine tumors, often found in the digestive system, release huge amounts of serotonin and other substances into the body. Typically, the liver acts as a filter, breaking down these substances before they can cause trouble. However, once these tumors spread to the liver, this safety mechanism is bypassed. The serotonin-rich blood flows directly from the liver into the right side of the heart. Let's look closer at the heart's right side. Here we have two crucial gatekeepers, the tricuspid valve and the pulmonary valve. In a healthy heart, these valves open and close with perfect timing, ensuring blood flows in one direction, from the heart to the lungs. It's a smooth, efficient, and beautiful dance. But continuous exposure to high levels of serotonin changes the music. Serotonin molecules begin to bind to the delicate tissue of these heart valves. This triggers a response similar to scarring. It stimulates cells called fibroblasts to overproduce collagen, creating thick, stiff, plaque-like deposits on the valve leaflets. As this fibrotic tissue builds up, the valves lose their flexibility. They become thickened and rigid. You can see the dramatic difference here. A normal supple valve on one side and a stiff scarred valve on the other. This damage is what we call carcinoid heart disease. The consequences are serious. The pulmonary valve can become narrowed, a condition known as stenosis. This forces the heart to work much harder to pump blood through the smaller opening, leading to turbulent, chaotic blood flow. At the same time, the tricuspid valve often can't close properly anymore. The stiffened leaflets leave gaps, causing blood to leak backward into the right atrium with every heartbeat. This is called regurgitation. Think of it as a leaky gate that can no longer hold back the flow. Doctors can visualize this damage using tools like Doppler echocardiography, which shows the abnormal and backward flow of blood across the damaged valves. Over time, this constant strain and leakage cause the heart chambers to enlarge and weaken. The once strong, steady heartbeat can develop a murmur, an audible sign of the turbulent flow. Patients with carcinoid heart disease often experience symptoms like fatigue, shortness of breath, and swelling in their legs and abdomen. These are often coupled with the classic symptoms of carcinoid syndrome itself, such as facial flushing and diarrhea. When these red flags appear together, it signals a need for immediate medical attention. The journey from a small tumor to significant heart damage can take time, but as the disease progresses, the heart's function declines. The good news is that we have effective treatments. For severe valve damage, surgery to repair or replace the affected valves can be life-changing. Surgeons can remove the scarred valve and implant a prosthetic one, restoring proper blood flow and allowing the heart to heal. This powerful visual of a damaged valve being replaced with a healthy, functioning one highlights the importance of early diagnosis and intervention. By managing the underlying tumors and monitoring heart health, we can prevent or treat the damage caused by serotonin overload. Understanding carcinoid heart disease is the first step toward better outcomes. It's a testament to how interconnected our bodies are, and a powerful reminder that paying attention to symptoms and seeking early medical advice can truly save lives. Thank you for joining us on this incredible journey inside the human heart. If you found this video informative, please give it a thumbs up, Subscribe to our channel for more content and hit the notification bell so you never miss an update. Stay curious and stay healthy.